This is Duke University.
Thank you very much, and thank you, Ron. There's some really inspiring talk, and I think as we move this program forward, some opportunities, challenges, and food for thought that you've left us with. We're going to move straight on to the plenary panel for this afternoon, and the focus of this panel will be exploring the need for new approaches to tackle challenges in global health. We have a phenomenal lineup of panelists today who are coming onto the stage. Mike Merson, the director of the Duke Global Health Institute, Krishna Udayakumar, the head of global innovation at Duke Medicine and the executive director of the International Partnership for Innovative Healthcare Delivery, Greg Dees, the founder of the Center for Advancement of Social Entrepreneurship here at the Fuqua Business School, Bonny Moellenbrock, the executive director of Investor Circle, and Wendy Taylor, the director of the Center for Accelerating Impact and Innovation at USAID. So thank you very much, and over to Mike to moderate the panel.
Thank you. Is this on it? No.
Look at the bottom. Nothing.
Testing, okay.
It's definitely not.
I'd like to, we will all yield our time.
Right.
Yes. Another hour, we're happy to do that. It's pretty hard to follow that and nearly have the dramatic impact. So let me just say thank you for what you've done, what you will do for the planet. It's very inspiring. I'm sorry that every Duke student couldn't have heard that talk. So here we are. We have a panel that is, if you look in your program, you have the title, I don't need to introduce, because in the back of this program there is a little bio on all the speakers. I'll just say we have Krishna Udayakumar from Duke Medicine, Greg Dees, who is the head of our seed project from Fuqua, Bonny Moellenbrock from Investor Circle, and Wendy Taylor from USAID. And if you want to know, as I say, more about them, I think we shouldn't take the time with long bios, but you can just read the paragraph in the back of the program. They're all very prominent in their fields, and they've all thought a lot about the topic of this panel, which is scaling innovations in global health. Now, the way we're going to do this is they're going to make a brief opening remark, and if it's more than brief, I'm going to stand up. And then I'm going to throw a few questions at them, and then I want to leave some time for some of you to throw some questions at them yourselves, with the theme of this panel being scaling innovations in global health. We want to explore the need for new approaches to tackling challenges in global health and how different sectors can learn from these approaches. So each of the speakers was told what they could have their initial comments, and we'll address an area of particular expertise and interest to them. So Krishna?
Sure, thank you, Mike. Is this working? I wanted to very briefly, I think, frame the discussion and some of the topics that the other panelists are going to hit on, and that framework is really to talk about what the challenges are today that we want to think about how best to scale innovations in global health. We're all familiar with the challenges. In the policy world, we tend to think of it as this iron triangle of health or healthcare. In the U.S., we talk about the triple aims, but at the end of the day, it gets down to how do you balance the ideas around affordability, quality, and access to care, and how do you optimize all of those in such a way that that everyone in the world gets access to high-quality care. Is this better? Yeah. Excellent. And so that challenge leads us to this idea that the way things have always gone isn't good enough, and even making incremental changes isn't good enough. So what we really need are transformative innovations, different ways of thinking, disruptive technologies, new models of care, ways that we can have step function improvements to these ideas of cost, quality, and access. In terms of what we see as some of the barriers to scale, many of us have spent time thinking about this, and I'll for the sake of this discussion, put them into 4 broad categories. The first barrier is really one of knowledge and networking. So we have innovators, entrepreneurs. You will meet many of them here today that are visiting us, but they are, in many cases, working in isolation from each other. There's not really a professional society of sorts to bring together these people that are developing fantastic ideas. So can we create a knowledge network around the world that's able to share information and address challenges together? The second is really around organizational and management challenges. So many entrepreneurs in social health are running startup organizations, and as we know, most startup organizations get to a point where they need to have professional management structures or principles to continue to grow and scale. And to do that, can we find ways that are creative to be able to bring professional management and organizational practices to these social entrepreneurs? The third is one that will be familiar to folks. It's around access to funding, to capital. It may range everything from impact investment and philanthropy on one side to traditional venture capital, private equity on the other, but how do we create more efficient markets to support transformative innovation? And finally, the challenges related to policy and regulations. So how do we ensure that we study not just innovations, but the ecosystems in which they exist to be able to better identify the critical success factors and barriers in those ecosystems, and how can we collectively make sure that we're addressing some of the policy and regulatory barriers? So I'll stop there and turn to my colleague, Greg.
Greg.
Yeah, no, I thought that was an excellent overview and introduction. And you might ask why we need social entrepreneurs at all in this kind of venue, and I think Krishna hit on the importance of this. Innovation is crucial to solving these problems, and it's hard to do innovation inside large organizations. Many large organizations are hidebound in terms of their culture, in terms of their standard operating procedures, in terms of the bureaucracy that governs them. I think I can certainly give USAID some credit for viewing that or recognizing that fact and setting up something like this program, the HESN program, to reach outside of USAID for innovative ideas about solving development problems, and to realize that the innovations often have to come from places outside your organizations. Many corporations recognize this now, and it's quite common for a corporation to look outside the company for innovative ideas to bring in. Google, for instance, has made probably by this point maybe 200 acquisitions or more since its inception, including Android, which was developed outside of Google originally, and Google brought it in and now has turned it into the largest cell phone and tablet platform in the world. It's pretty amazing what can happen with outside innovation. It's extremely important for us to foster independent innovation and innovators coming from all kinds of angles, different perspectives on these great, huge problems. We need that independent point of view. And then we need to figure out how to support it. And I think Krishna identified the key areas in which we have to provide support for those innovators. But we need to think about what they're doing in a way, and I think Alex hit on this when he talked about, he gave the analogy of science. These are experiments. We need to think of them as experiments. We're learning from these innovators about what works and what doesn't work. And if they're going to be experiments, we have to figure out how to evaluate them. And one of the reasons that capital markets don't work very effectively here, we often don't know what's working and what isn't working. We don't have good data. And as a result, the capital is inefficiently. It's flowing to things that people kind of like, things that resonate with them. It flows to organizations that can tell good stories or have good marketing. Persuasive marketing, they can tug at your heartstrings, but they may or may not be the organizations that are delivering the most effective or most efficient or most powerful innovations in a given sector. So we need to figure out how to test these experiments, how to identify which hypotheses are correct, which are the most powerful, which ones are going to solve the particular health problem or social problem. So that's an important thing that we need to do. Then we do have the barrier of how do we get resources to them of all kinds, not just financial resources, so that we can help scale up those innovations that are working and scale the impact of the innovations that are working. And I think this is where Ron raised some key issues with collaboration, because usually an individual social entrepreneur will have a very slow time scaling up their innovation, and that's been one of the criticisms of the field, is that social entrepreneurs often are slow to scale. There's some exceptions to that, but by and large, they tend to be slow to scale. And so critics will look at them and say, oh, we've got this big problem, and that social entrepreneur is only touching this small part of it. Even if they have an innovation that could help solve the big problem, people will be critical about that. But that's not just the social entrepreneur's problem, it's our problem as a society. We have to figure out ways to get resources to those social entrepreneurs. And they're going to do it through collaboration, and it may well be collaboration with larger organizations and agencies, and we have to figure out how to make that happen. Partly because in many cases the profitability of these social entrepreneurs is not so high that it's going to get the Googles rushing in to buy them up, the way Google did with Android. So if we don't see that happening, how do we get organizations that can bring large-scale resources to come in and adopt these innovations and help spread them? How can we find the partnerships that are going to scale these organizations up? And I think that's another huge question. If we can get good data on what's working, and then if we can find the ways to bring the right resources, organizational as well as financial, to scale the impact of these innovations, I think we can make some great headway. So I'll stop at that point.
So Bonnie, you're
Great.
going to bring the resources.
All right, yes, we're working on
Yes.
that. Yes. So we're looking at bringing resources that maybe we haven't tapped as much before in global health, and that's we're looking to bring more private sector, private capital resources, and that's why Investor Circle is very thrilled to be a part of this. And first of all, making sure everybody's on the same page and what is impact investing anyway, make sure everybody understands that's investing with the intention to generate positive social and environmental return alongside financial return. This is not philanthropy. Many times it could become it, and it doesn't always come back, but these are investors that are willing to take that risk, and that's what's needed right now, right? Because we need to test these models. And sometimes it helps when you care about that impact to take that plunge. Nevertheless, there's a discipline that brings in terms of looking for business models that are sustainable in the long term and can hopefully replace some of the philanthropic capital that is required now to address some of these challenges. So it's not terribly surprising that with the growth of social entrepreneurship, there's also been a growth in interest in impact investing. 20 years ago when Investor Circle was founded, it really was a circle of folks that were kind of the crazy ones, thinking you could do this. That has now changed. It's starting to hit the mainstream. In 2009, Monitor Institute did a report looking at this space and estimating it in the next 5 to 10 years. Perhaps 1% of assets, financial assets under management, could be directed to impact investing. So that 1% doesn't sound like a lot, but that's $500 billion. That can make a big difference in leveraging the resources that we can currently bring to bear on some of the greatest challenges that we're facing around the globe. And I think we all agree that's a good thing, because we know that our philanthropic and public resources are just not enough to do that. If we can leverage for-profit businesses and provide financial return on investment, that can bring a lot of more people, a lot more resources to the table here. And then free up resources to address the most entrenched market failures. There's always going to be things that don't have the for-profit business model that can address them. And so the more we can find the ones that do, using our new technologies and collaborations, the more we free up capital to address those more challenging. And I think, we all know profit motive can not always be a good thing. It is a very powerful thing. Too often it's not motivating positive things. But when that can be harnessed for good, it can be just as powerful in moving the market and moving the needle on impact. So we're thrilled to be here to be thinking about how can we best move the impact investing field forward in a systematic way around a sector. I think it's also time in the impact investing space where you have more interest in particular areas. So we're excited about this to see how can we very strategically and thoughtfully move a particular sector forward. Can we kind of make this happen a little quicker than it otherwise would by having expertise of all the ecosystem players around the table? So excited to be a part of that. I was going to give an example about what Investor Circle has invested in to do this kind of thing. I don't think I need to, because I've enjoyed this past 2 days with these innovators, and you're about to have a treat later to hear from them on the types of innovations you're doing, and that will be suffice on the inspiration. So I'll pass it on to Wendy.
Thanks, Bonnie. Wendy?
Great. Well, first of all, I just want to congratulate all of you for bringing together this cross-disciplinary approach, and I really think it has the potential to be very powerful not just in supporting innovators coming through this program, but you're going to generate so much learning for the field. So I'm very excited that we're a part of it. And Alex talked quite eloquently about our innovation agenda here at USAID and how we're infusing innovation and science and technology into everything that we're doing. And one of the things we're looking for is really looking at investing in those game changers that can have a dramatic improvement against our development challenges. And one program which Alex mentioned, and I'll expand on a little bit, is Grand Challenges for Development. And that's a program where we're challenging innovators and entrepreneurs throughout the world to be able to apply their best ideas to some of these intractable problems in development that we just haven't been able to figure out how to tackle yet. And a program that we set up in the Global Health Bureau, Saving Lives at Birth, was the first grand challenge for the agency. And we were looking for groundbreaking prevention and treatment approaches for pregnant women and newborns around the time of birth, which is when the majority of deaths occur, and also in the hardest to reach parts of the world, which that's where the majority of deaths occur. And it's through this program where we've been looking to harness this sort of untapped repository of change agents. And I think I saw some of those yesterday when I was in Bob Malkin's class and looking at some innovators tackling some real world challenges and coming up with some great creative designs around some interesting health problems. But this is the kind of thing we're looking to spark these creative ideas and new ways of solving problems. And so through Saving Lives at Birth, we've generated through several rounds 39 innovations. It's a highly competitive program, not to dissuade anybody, but we're only funding about 3% of those who apply, since we've got about 1,200 applicants in the first two rounds. Karen can tell us we had our third round already with another hundreds of applicants coming in. But it really shows that there is a lot of interest and ideas out there to try to tackle some of these major development problems, and we want to be able to channel those, harness those, and bring them in, and that's really helping us expand what's possible in development, but it's also helping us change the way we do business. And one of the things that we're doing in terms of changing the way we do business is thinking about not just how we accelerate development of interesting innovations, but how we think about introducing them and rapidly scaling them in the field. And we need to get better and better at how we do that. And we have hundreds of technologies that we already have available now that are not reaching everybody who needs them, where we don't have the kind of coverage we need to have the impacts we desire. And when they do get there, they take too long to get there. So one of the things we've recently done, which came out of an idea from our administrator, was to create a center of excellence in the Global Health Bureau to bring in much more business and marketplace thinking into how we think about not just supporting development of innovations, but rapidly introducing them and scaling them in the field. And so we're looking at bringing in some of the best practices from industry, who knows quite a bit about introducing and scaling technologies, working in different markets. Also best practices from academia as well, and that's where I think our relationship with Duke can really bring us some very important insights. So we are focusing in three key areas in the center. So first is bringing in these best practices and thinking, and that I really believe this is as a center of excellence, we need to bring all the thought leaders in globally and harness those best ideas. But then we need to be able to apply them internally in terms of how we support development of innovations, how we build partnerships with private sector, with NGOs, with various players that are part of this larger ecosystem. But then also bring those lessons to how we introduce and scale technologies. And so we're really thinking about how do we make sure we have the right design from the first place. And one of the best places to address problems with scale is actually in the lab in the very beginning, making sure you're designing with scale in mind. You're designing and understanding what the market needs, what the market will use, what the market will bear, and users have impact on that. And then making sure we have the right approaches to rapidly introduce and scale them and get that adoption. And then there's another piece to that is also addressing the market issues. And we're talking about operating in markets that still have a lot of inefficiencies. And in some cases, we need to look at how we can enhance those markets to make them more attractive for industry to operate in, more attractive to scale technology. So I have some ideas on that front. I'm afraid I'm going to make Mike stand up if I keep going further, but I have a challenge for all of you, so if we come around to it, I'll let you know.
Why don't you take another minute?
Okay, all right. So one of the things that we're spending a lot of time thinking about is market shaping. So if we have a lot of these technologies where we're looking at trying to encourage industry to introduce products in the marketplace, you're dealing with markets where the purchasing power of many of these patients may not be what it needs to be. The market opportunity is not as attractive as it could be for industry. So there are ways that we can engage to try to enhance those markets, whether we can guarantee markets, we can guarantee pooled procurement. There are different mechanisms that we're getting smarter at how to use these to enhance markets, to reduce prices so that we can increase access. CHI, the Clinton Global Health Access Initiative, has done a lot to bring down the cost of AIDS drugs using various creative market shaping tools. It's an area where I think there's a lot of learning to be done, and anytime you're starting to play around with markets, there's also can be some unintended consequences as well. So I think we need to get smarter at how we do this. Right now there's a handful of very high-paid consultants that have, I think, the real expertise here. What I challenge all of you is to help us learn more about how we can better shape these markets in ways that help us achieve these development goals, that help us ensure broad access to these technologies and scale these social innovations. And so I think there's the learning to be done in terms of what are the tools that we can be applying, the learning to be done is where we've applied them well, where we've not applied them well, and what cases does it make sense to use them and what cases not. So there's a lot of learning, and I think there's a space for academia to build out that discipline and thinking, and it requires bringing in, I think, a cross-disciplinary approach, understanding of global health, understanding of the business and markets, and so we need economists, we need business thinkers, we need people who understand development. So that's my challenge to all of you.
Very good. Okay, I think wonderful opening comments. Let me ask all of you to think about this. There are so many people with ideas, and there are so many challenges. So how are we going to scale? How are we going to ensure that we scale the right solutions that are addressing the most important challenges? How do we prioritize? How do we get the most in this area? Any thoughts? Greg?
Yeah, that was a cold call, but thank you. I love those. Yeah, so this comes back to the issue of measurement that we talked about before. But if you're going to go for the, what are the big, most important, most pressing issues, you need big databases to determine that. We need to think about where are the biggest problems, bottlenecks, if we're thinking about global health, that are affecting, what are the biggest issues that are affecting the quality of people's lives in terms of healthcare and in terms of health outcomes. And there we can get at that with big data analysis and understanding what that is worldwide. So we can look at issues like maternal health and deaths at maternity. We can look at deaths related and quality of life related to AIDS and tuberculosis and multiple drug resistant tuberculosis. We can look at malaria. We can look at a number of things and try to get a sense of where we think the highest priorities are for intervention. We can also rank those relative to where we think we have tools for intervention that are promising. So ideally you can think of a matrix. And a matrix of, here are the things that are taking the greatest toll health-wise, and here are the things that we think we've got tools that can actually solve them, and where you've got the overlap of high problem, a very serious problem, and we've got tools, but the tools are not getting out there. To me, that's where we ought to be focusing our efforts, because we got to figure out how to get those tools to the problem areas where we can solve them. So if we've got that gap where we've got tools that we think we're confident can effectively solve the problems, and we've got serious problems that are costing a lot of lives or creating a lot of morbidity, as you might say in the healthcare side. We need to get the tools to the locations and into the hands of the people.
So that leads, I think, to the next question, which is, what does it really take to scale? I mean, what is in the ecosystem that our innovators live in?
Yeah.
What are the key parts to scaling? I mean, what did we learn? Anyone want to take a crack at that? What really matters in scaling?
Go for it.
Greg's probably got a few decades of experience in studying.
I do, but I just answered the last one.
I can call on Greg again, but I'm
Yes.
Sure.
Yeah.
I think this is what we've looked at for a couple of years through IPIG, at least to start. And I want to reinforce a point that Greg just made around really understanding metrics and program evaluation in a way that we currently don't. I think we're in many ways stuck in this. If you look at the continuum of how we understand this, on one end is a very focused and academic approach which relies on very in-depth analysis that can take many years and cost many millions of dollars to understand the true health and economic impact of any individual intervention. And on the other end is in many ways where we live today, which is understanding and hopefully believing some anecdotal information, maybe a little bit of quantitative data thrown in, but what we don't have is a shared understanding of what we need to know, what's the middle path, and so I think we actually need to work on the methodology part of program evaluation of how do we develop a system that across the appropriate stakeholders is understood, is supported, and is reliable and replicable. And I think, in fact, through the Higher Education Solutions Network and the engagement of the universities more broadly, it is something that we can take on as a shared challenge. So I think that is, in fact, one of the areas we have to make progress. If we're going to be successful in scaling, we have to know why we're being successful. We have to be able to show that we are or not being successful.
So all you evaluators in the room, Krishna is wanting creativity.
Well, but I'll add is this: the investor in the room, that it also needs to be quite feasible if we want these companies to also focus on what they're achieving. So I think that's wonderful about this partnership, is we'll be able to hopefully leverage the academic and the resources that you bring, and then also to feasible solutions in the field. And also, and this gets back to the past question too, just I think having the financial perspective in the room is an important one. We talked about the impacts. And then there's about the other aspect of scaling, which is the business model a scalable one, and how feasible is that? If it is a market-based solution, is it the right one and the most effective and scalable one? And so there's a whole nother perspective when you come to the table with someone whose first thought might be about the financial side. And it can seem a little harsh. In the conversation with the entrepreneurs this morning, one said, well, I was talking to one investor and they listened to me for a little while and said, so how long till you go out of business? And that seemed a little harsh, but guess what it did? It also helped instigate a change in the business model that ultimately is providing a more scalable model. So there is another kind of discipline that comes when you really are looking at those numbers as well as the impacts. And so the fact that we have both of these at the same table, I think is critical, and hopefully can result in more quickly realizing this one isn't scalable, and this one might be more potential.
Wendy, you want to comment on this?
I was just going to say, it's interesting. I've been thinking about this from the standpoint of these social enterprises. You guys are looking at a lot of these healthcare delivery approaches. We're also thinking about it from the technology angle as well. And for a lot of the technologies, you also, in addition to you need the right design for the right market. You need the data to be able to show it works. In many cases, you may have policy changes that need to take place in the countries to be able to ensure adoption of the products. There may be some similarities in terms of some of these health technologies. There's a whole advocacy component. It's kind of the demand creation component as well. And that's both for the users, but it's also the countries that are adopting. You need the countries on board. Having local buy-in, country buy-in for many of these innovations, and I know this is true for a lot of the innovators that are here, is a very important piece of that as well. And then even the service delivery channels. So for technologies, they need the service delivery side of it to actually be functioning well as well. So all of these pieces, if you have any kind of barriers along the way, you can hit some pretty big stumbling blocks.
Okay.
Yeah, I would add just one thing, Mike. So, also, they need the human resources to pull this off if they're going to scale up, and that can be very difficult to find, depending on what the organization is doing, and to the extent that they're dependent on particularly skilled labor and professional labor, and they need managers to scale up. That can be a challenge. And it's particularly a challenge for those operating in developing economies where those with skills often migrate out, and they often will go to developed economies and send remittances back to their families rather than stay in the developing economy to work. So it can be a challenge to find the labor you need if you've got a technical innovation in a developing economy, and that can be another barrier to scaling, which is a challenge. So the human resources can be just as important as financial and political and all that.
Okay, so let me ask if any of the innovators in the room want to ask a difficult question to this panel.
Yeah.
Some of you, anyone want to ask a question? Yes.
Or an easy question.
Or an easy question. Okay, just identify yourself so people
Sure.
know you.
Hi, Janine Sasso with Durham's Next Program, which is part of the Center for Child and Family Policy at Duke. I wanted to ask, you're talking about evaluation and efficacy, wondering if you've, thank you. I'm loud, but maybe not that loud. I'm wondering if you will incorporate implementation science into your replication and evaluation efforts?
Okay.
Absolutely. I think everything we're talking about is truly implementation science. So I think there's a lot of evidence that exists, but how do you put that evidence into practice? And that's what a lot of our innovators are doing. And I think in our program evaluation, I really think about it in two ways. Part of what we want to develop are the metrics and the evaluation, the science of how to measure appropriately the impact on the ground, whether that's a health impact or economic impact or social impact. At the same time, part of this model of implementation science is we have to be able to evaluate our model. We're going into this with the hypothesis that the types of interventions we're putting in place are going to be effective at helping to scale the impact of these innovations. And I think we have to be able to develop a set of data and evaluation metrics so that we can continue to refine our own interventions over time to be more effective.
I mean, I think that's true even, I think it's not just how successful you scaled. I think what Krishna is pointing out, what's been the health impact? And how can you get that in a feasible way, in an affordable way? And that's really the biggest challenge, not just overseas. It's also a challenge right here in Durham, as you know, with our own health system. Other questions from anyone in the audience? Don't be shy. Yes, in the back. Just say a word who you are, that's all.
Scott Kleiman, I'm a second-year MBA student here at Duke. I wanted to ask particularly Greg and Bonnie, when you think about scaling innovations in health, how are the challenges distinct from scaling innovations from other types of organizations in the social entrepreneurial sector?
Such as?
So people doing in energy,
environment or education or energy. Right. Yeah, so each sector has its own kind of unique challenges, just as each industry has distinctive challenges on the business side. In health, quite often you're operating, and it's a little bit different in the US and other countries, but you're quite often operating in an environment that's dominated by government organizations, government providers, but you may also be in a country that has officially a public health system, but a public health system that reaches only a very tiny part of the market that needs to be reached. And so you have to pay attention to, clear attention to the borderlines between public and private.
That's innovation.
That is, it's clearly. That's right. All right, I'm sure that was probably some important message.
No,
it's all right. This is White House calling or something. Yeah. All right. So clearly, you have to look at the dynamics of the health sector, who the dominant players are, who's being funded by whom for what. In the U.S., you've got markets with health insurance providers. You've got to pay attention to who's paying. And in many healthcare situations, there are third-party payers involved of some sort. And in many cases, the frontline patients are not able to pay out of pocket for the full cost of delivery. I love the musical accompaniment.
You have to dance now.
Yeah, so anyway, so I think it's part of it. You look at, so in each market you've got sort of who's paying, who you need to get on board, how you do it. So you may come up with creative solutions, in this case where you get employers to pay, you get other folks to pay for healthcare for workers. You find some third party who's willing to subsidize or pay in the case of people who are too poor to pay for their own health care. You find some micro insurance solution, but it's going to be a very creative and limited solution. You get government clinics to adopt your innovation and implement it. But the structure of the industry is going to be a bit different in each sector. So education will be a little bit different still, and then you're going to have, though government involvement in education may be high as well.
Do you think it's more difficult than health?
I don't know yet. And I think I'll have a much better sense as we work with this cohort of innovators. My prior work has been scattered across multiple sectors, and I don't think I've had enough depth in health to say that health is more difficult in general across all countries. I think it may well depend on the country environment which you're operating. So I don't know that health in Kenya is more difficult than education in Kenya. I have no idea. I think both of those are probably very difficult in Kenya. So I think it'd be hard to make a generalization.
One thing I've heard recently, the Monitor Group had done a lot of looking at private sector enterprises both in India and Africa, and one of the things they found is, first of all, there was more of a shortage of the health enterprises in both sectors, both areas, but the health enterprises really had trouble actually accessing capital in ways that some of the other sectors didn't, and difficulty actually accessing loans. And I think there was, I don't know whether that's, there's less of a evidence base that those enterprises are going to work, and so they're seen as higher risk. The doctors sort of hightail it out of there and go off to their private practices. I don't know, but that's certainly some difference that we'd seen in health as opposed to other sectors.
Yeah, and I would just highlight the notion of the who's paying. That's a critical thing. We're looking at business models. It can be very challenging for an investor to get confident when it's at the third party, and then what is the sales cycle of that and how reliable, et cetera, especially if there's markets they're unfamiliar with as well.
Good point.
Yeah, one other point I would make is, especially in developed economies, the barriers to entry in health care tend to be much higher than in other sectors.
Yeah, that's what I was thinking.
And so certainly in the U.S., we've seen that as a barrier to innovation, and so that may adversely impact the ability to replicate some of the innovation we're learning from other places and bring them back to developed economies like the U.S. or UK with highly regulated markets.
Yeah, and it's worth mentioning that reverse innovation is part of what we're thinking about as we do this process as well. So we work with these innovators thinking about what might be brought back to the U.S. I think it's a very intriguing possibility.
I think that's
challenging.
I was discussing that with Ariel this morning, that this may be a real interesting spin-off of this project, is what do we bring home and make better in our own country, which is not necessarily AID's goal, but I think a really fascinating question to ask. How much can we use seed to make a healthy American population?
And it might not be a bad sort of political outcome for USAID if it also benefited the U.S.
Other questions in the audience?
Hi, I'm Scott Phillips with the Duke Center for Civic Engagement. I really wanted to kind of, Wendy, one of the points you made about we've got these technologies, we've got these innovations, but sometimes there's policy problems, there's other issues in getting it implemented most effectively. Is there any system in place that is, this innovator has a problem with getting there, or if we could also have somebody that's working on an environmental issue, also we have this policy issue. Is there any system of connectivity put in place to address like this interwoven processual issue?
I don't know if there is one. Maybe that's something that we'll be able to get through here too. I mean, I think one of the things that we're trying to do is, by establishing a center of excellence, it's really trying to bring in a lot of that thinking. We're trying to bring in the thinking from different sectors and understanding all the different barriers along the way. So policy barriers may be one. But how do you tackle those? I think one of the things, to your point on that one, with USAID, we actually have a great deal of development expertise in being able to think through how to work through some of those policy barriers. So it may be getting a country to change its practices on what drugs should be used for a particular disease. Perhaps it's trying to address regulatory challenges. And so there's a lot of things that we can be doing on a systematic basis to try to address some of those larger cross-cutting issues. But we need to be able to pull a lot of the lessons down and make sure that they're disseminated in some way that we can share them. I mean, we have trouble sharing lessons even within our own silos within health. So we have our own silos of excellence with HIV and TB and malaria, and we're not very good at even sharing the lessons across the sectors within health. And finding a way to, reach beyond that and share lessons from other sectors as well, I think is where we can start to continue to push ourselves out on the front end of the adoption curve of these best.
And I'll add on the kind of investor circle membership side and our network, we're looking across the board at all sorts of impactful business models, everything from environment to health, education, et cetera. And so, for example, we have one member we talked to about joining the advisory board, and they said, well, how do you define health? And they said, because they're extremely interested in water. And if you scratch the surface of a lot of health issues, a lot of it can go back to what is the water quality there. So we are inherently, a lot of folks in our network are thinking across the board. So that's something we can bring at least, is saying, gee, there is similar work going on in that region in water and on some other things. And what can we learn from these other business models and systemically about the related problems that we all know are really
So
connected.
let me, as we get near the end here, let me ask each one of you a very simple question, which is, what would you like more than anything else for SEED to achieve? I'll let you go last since you're the funder. But what would you, if we were now sitting together 3 years from now or 5 years from now, what would you be the happiest, or at least from where you sit today, that SEED would have achieved X? What would be make you happiest? Krishna?
I'll start. I'd put it into two categories. One is impact, the other is insights. So I think the idea is impact on the ground. So what are we seeing that is evidence-based, that shows that we're improving people's lives? And the second is insights. Have we done enough about learning from that experience, that we've developed insights that by themselves are going to help us scale the impact, not just in health, but in other sectors as well. So what do we learn through this process about how to scale and how best to scale that we can share with everyone else?
Greg?
So I could almost just say ditto. It's quite so, but it would fit into both of those categories. And in terms of impact, I think not just the impact of the innovators who happen to go through our program, but I hope that impact will stretch out into whole networks that get created, not just networks of our innovators, but networks that get built through our innovators and other folks that they work with, and beyond, that we start to have a ripple effect within global health, and that we do capture insights that we can share outside, even beyond global health, about ways to scale impact effectively that can be shared in other arenas as well. So I would just second that. I thought that was brilliant and concise.
Bonnie?
And I'll third it. You're making this hard because you just took my list. But so I will echo what we heard earlier about collaboration. It would be great to say, wow, it worked. We did this. So there were some hard parts. So here's something we learned.
You want Ron to be happy.
Yeah, we would love Ron
I want to
be
say,
happy.
yes, I was right. And say, and something that can be replicated. We are eager, like we have these other areas of interest. Is this something we can replicate and bring to bear in other areas? And can it also bring more capital into this space? I would like to see more capital to be able to say, we've moved, $20 million into impact these innovators, companies from the private sector that wouldn't have been there before, and that it created impact.
Okay.
All
Wendy?
right, well, as your funder, I think you all passed. No, I would just so echo all of that. I think all of those are right on target, and just add a couple more things. So one is on I think the insight, the learning that you're going to generate from this is going to be so valuable for the field as a whole, and will have ripple effects far beyond anything that happens right here at Duke. I think paving the way to investors coming in to invest in health enterprises is so important. We need successful enterprises to show that it works so that we can open the door to all that and unlock all that capital that's allegedly sitting out there waiting to invest. And then the last piece I would say, and I know there's a student engagement piece of SEED as well, and I think that's really a truly exciting piece of this whole program, and finding ways to sort of unleash the ingenuity and the excitement and interest in the students, and certainly students I've talked to here in the last few days that I know are out there, and being able to apply that to development in many different ways, I think is very valuable also for the field as a whole, and this is the next generation of our development experts or people who are working in other sectors but have that vision. So I think what you're doing here is extremely exciting and important.
That's a great amendment. I did think of one last thing. I'd also love for us to continue to influence the way that USAID innovates in this field. So I hope that what we do influences the way you think about your work going forward, and vice versa, that we continue to innovate together.
I think that's a very important point. You know, those of you who know the history of AID and the history of universities, there hasn't been a lot of crossing. And I think this has really been a very innovative and somewhat brave, and Alex referred to this, and you know, AID can spend its money in many ways. And the fact that they've really brought us in adds a dimension, and we need to be thinking as a university, what is that dimension? What is the addition that we bring? And I think, obviously, the intellectual piece, the evaluation piece, the strategic thinking, and of course, your point about the future. And I think I've been very impressed how from the beginning, from the RFA right to the present, the consistent feeling of USAID that they really wanted to reach out to tomorrow's innovators, not just today's innovators. And I think that's, I think it's something that you've alluded to, and you've just alluded to, which I think from the standpoint of our university, it really is at the heart of so much of why we wanted to do this and why we feel privileged to do this. And why, Alex made the point about the discovery by undergrads. There are a lot of undergrads out there with great ideas, and this will give them an opportunity, additional grad students, but to make a difference. And so for that, I think we owe that, as a university, we owe that to this project, and we will do our best to deliver in that regard. So our time is up. I'm trying to keep us on schedule. Thank you. To the panel, thank you to the audience. And Richard, are you here? Thank you.
Good job.
Thank you very much, and thank you to all of the panelists, and thank you, Mike, for moderating that. And I think I speak on behalf of the entire team at SEED that we're delighted there's so much alignment and agreement across our leadership about what we need to be achieving over the next 5 years. It's going to be an exciting journey. We're going to be going into breakouts now. There are 3 separate breakouts that you can select from. The focus of the breakouts is going to be really learning from the innovators who are in the first cohort, and we've got a phenomenal set of organizations that are going to be represented here. Breakout number 1 is in HCA, and will be Chanjamko, Kumin, Hartfile, and Nayajiman. Breakout number 2 is in McClendon, McMeadows, Jacaranda, Riders, and Holga, and Salahuna. Number 3 is in Lily, and it's Weekester, Operation Usher, Pendas, Roxhill, and Lapsalia. For those of you that don't know where the different rooms are, if you head out of either that door or that door and turn right, there will be people pointing you in the different directions. And for those of you that would love to go to many of the different breakouts, there will be an opportunity in the afternoon to network with all of the innovators. So there's plenty of chance to speak to everyone. We'll be reconvening back in this room at 3:30, so please try to be back here by 3:30 for the closing keynote address by Aaron Kaplan-Mendez from USAID. Thank you very much.
Produced by Duke University, online at duke.edu.